senators, and interested viewers. Thank you for taking the time to listen to my concerns and suggestions. I am Teresa Miller, a community volunteer from Tampa, Florida. I'm here today representing all the families who have been victims of marijuana use. By that I mean the thousands of families whose loved ones began to use marijuana believing it was harmless, then quickly transitioning to harder drugs. Not everyone who smokes pot will have an addiction problem, but almost every addict began their path of addiction abusing marijuana. I'm a parent who is a victim of marijuana use, even though I wasn't the person smoking it. One of our sons smoked pot for a year, then springboarded to OxyContin. For this reason, I obtained a master's degree in mental health counseling in 2012. Last month, the Surgeon General stated that the United States has an addiction epidemic. 1 in 7 people are struggling with addiction. There is a correlation between legalizing marijuana and an increase in addiction. Recently, a police officer told me at every heroin overdose, marijuana use is evident. I'm also speaking for the families of innocent people who lost their loved ones in car crashes related to marijuana-impaired drivers. This has been occurring in our state even before marijuana was legalized. Anyone can be a victim of these consequences, even if you personally don't use or abuse marijuana. I do admit that marijuana has potential for medical use, but only specific components, such as CBD, not the entire plant, and not marijuana with THC. So now Florida has chosen to enter the clouded, smoke-filled arena of labeling pot a medicine via popular vote, thus circumventing the standard FDA approval process. There are several questions and procedures that must be explicitly detailed. If marijuana is going to be labeled a medicine, then the same medical and safety standards should apply. Criteria and policy must be outlined. Specifically for each disease or symptom that was identified in Amendment 2, we need to define and determine the following. 1. The most beneficial or least harmful potency. We need to set strict limitations on the amount of THC. 2. Which type of marijuana should be recommended? 3. The length of time a patient should stay on this medication. 4. The safest route of administration. 5. Follow-up procedures to ensure the drug isn't being abused. And 6. A list of drug interactions. Given what we know about smoking and the damage smoke causes to respiratory systems, not only to the person smoking marijuana, but secondhand smoke, the fact that smoking marijuana is the most popular method for recreational use, I would recommend we exclude smoking marijuana to include vaporizing form to protect our children as well as adults. In addition, other states that allow edible medical marijuana have experienced a significant increase in emergency room visits and hospitalization, basically for 2 reasons. 1, it looks very similar to non-cannabis products. And 2, the potency of edibles is extremely high, which makes the effects even less predictable and more variable. There are 3 areas of major concern that need to be addressed. First and foremost, our educational system. Every state that has legalized marijuana for medical reasons has observed a significant increase in youth usage. Florida is already ranked among the top users even before legalization. Evidence also now shows that there is a direct link to medical marijuana legalization and the dropout rate. Colorado has been forced to allow medical marijuana in their school system. We need to determine what we're going to do here in Florida. Second, our transportation system. Should we do random testing of public transportation employees? Should we make that mandated? This includes, but not limited to, Uber, taxi, public bus, and school bus drivers. Every state that's legalized marijuana for medical reasons has documented a substantial increase in fatal car crashes. We need to determine an accurate testing method for impairment. This is complex for several reasons. First, unlike alcohol, marijuana stays in the body system much longer. An impairment level lags behind the blood test level. Plus, other factors to consider in marijuana use and the impairment levels are if the person's a daily user or just infrequent. So it's a very complex testing procedure that we need to decide and determine for our state. We also need to decide, because of this impairment problem, should we fund more DREs? We need more drug recognition officers out in the field to help prevent these car crashes and innocent people from dying. The next area of concern are our businesses. Where does medical marijuana fit into an employer's options? Every state that has legalized marijuana has seen an increase in absenteeism, accidents, and insurance. How can we protect our businesses from these impaired employees? If we don't aggressively seek to limit the use and sales of marijuana, our country and state as we know it will never be the same. Florida will be trading its beautiful white sandy beaches filled with vacationing families for hazy, skunk-smelling coastline laden with unemployable, unmotivated, and homeless people. Florida is just recovering from the prescription drug epidemic. Do we really want to relive the nightmare of that epidemic? Thank you for listening.